welcome to today's video on making decisions. So like yesterday, if you were a bit freaked out about me offering you to have sex every 2 to 3 days, and especially if you're someone with PCOS and you're not someone who's used to having regular sex, I highly encourage you to look at this process of mine where you are bonding decisions. Like, it's not just about having sex, it's about keeping a chart and tracking whether you texted him with love, whether you smiled at him today, whether you touched him, whether you hugged him, whether you kissed him, whether you guys had sex, and how often a day are you doing that. So these are decisions that you can make ahead of time, along with other decisions like food decisions or sleep decisions and exercising decisions. This is the step 1 process of the 5-step process. Now, if you want to know more about this or you want to get an access of this sheet, please follow the link that I have provided and you can purchase it. It's just for $10, but then it will be those $10 you pay to commit to yourself. All right, so the first steps are going to be, it's not just about decisions to becoming insulin sensitive. It's about making those decisions that are guilt-free and shame-free for you. All right. So what do I even mean by guilt-free and shame-free? Is like, because our brain always has information on what is good and what is bad. And we still continue doing the bad things. And that's something which harms us. And that's the judgment of ours that we have when we do something which we know we should not be doing, is something which kills it for us, which makes it worse for us. So these are some of the decisions that you're going to make, like, what is your current weight, how many meals a day, how many hours you will sleep a day, how many minutes you'll exercise, how many times sex you'll have during a week, and by which time you're going to be pregnant. Just let your brain simmer with these decisions. And then you're going to make some food decisions ahead of time. Like, what are the pregnancy safe carbohydrates? Now, if you want to know more about it, please get that 5-step process course that I have. It's a $10 course wherein I talk in depth about what is safe and what is not safe in pregnancy, especially when it comes to diabetes in pregnancy. That's something which I am like a master with. So we can bring all of that. You can get in depth with that information there. So you can make these decisions right ahead, even if you don't have $10 to buy that product. You can just decide in your brain whatever information you have. What are pregnancy safe carbohydrates? What are pregnancy safe proteins? And whether do I like them? It's not just about having salad every meal, right? You need to like it. You need to meet yourself where you are. So it's not just about eating healthy food. You need to choose the foods that are healthy, which you like. So you make those decisions ahead of time for the proteins, the fats, the safe nuts, the foods that you're going to avoid in pregnancy. So those decisions are going to be made ahead of time. And also the sleep decisions. How much are you going to sleep? What time you're going to be in bed? What are you doing right now? And what are you going to do henceforth? Because sleep is very important. When you are sleep deprived, when you're not sleeping well, your cortisol is high, your stress hormone is high, which worsens your insulin resistance. So even if you're eating healthy and if you're not doing this bit, you will still be insulin resistant. Also exercising. Our goal is to exercise 5 minutes a day. Because exercising, what it does is, I'm not really so much into exercising will improve your insulin resistance. Yes, it will for sure. But the way we are programmed in our mind, the way we think, the way we are in our motivational triad, it takes us forever to even get started with exercising. So that is something which we can curtail by starting with just 5 minutes a day. And also exercising helps you feel better. When you feel better, what happens is your stress hormone comes down, your insulin resistance improves, and also charting your bonding. So this is what we're going to chart, and I'm going to talk about how we're going to track in the next episodes. And also the step 5, the most important one, celebrating every day. When we do the steps, we give ourselves rewards with good job, well done. You decide these rewards ahead of time so that you're not short of giving yourself, you're making it easy for your future self to celebrate. And also you'll keep charting your weight every week for 6 months until you get pregnant, and how your periods are going to be, the cycle length, and how many days you bleed. So tomorrow I'm going to talk about the details of tracking and assessing it.